Hello, I'm Mary Beth Swanson, Social Services Secretary for the Salvation Army's Central Territory.
Hello, I'm Michael Smith, the Assistant Social Service Secretary and Pathway of Hope Director.
Since the outbreak of COVID-19 global pandemic, Salvation Army personnel have been on the front lines of responding to the needs of families and individuals across the 11 Midwest states, which encompass the Central Territory. In a matter of weeks, millions of people have either lost their jobs or been furloughed with no determined date when and if their jobs will be there when our economy is reopened. The necessary measures to protect public health and safety has had not only an economic impact on families and individuals, but has also impacted our society's norms and daily routines. From preschool through graduate school, our educational institutions have been physically closed. Millions of students are completing their coursework through online learning. Senior proms, spring recitals and programs, and graduations have been canceled. Millions of students are experiencing grief as these milestone moments have been taken from them.
Many parents are juggling working from home themselves while attempting to guide and support their children's e-learning plans. Or perhaps they have the added burden of being furloughed or terminated and are themselves stressed out about approaching bills. Thus, it's very difficult for parents to focus on the needs of their children or young adults at this time. Certainly, this has been a very stressful time for everyone, but coping with stress in a healthy way can address our sadness and a sense of loss and hopefully strengthen our families. Mary Beth, what can parents do to help their children?
Children and teens react in part on what they see from the adults around them. When parents and caregivers deal with the COVID-19 crisis calmly and confidently, they can provide the best support for their children. Parents can be more reassuring to others around them, especially children, if they are better prepared. There are many things you can do to support your child at this time. Take time to talk with your child or teen about COVID-19. Answer questions and share facts about COVID-19 in a way that your child or teen can understand. Reassure your child or teen that they are safe. Let them know it is okay if they are feeling upset. Share with them how you deal with your own stress so they can learn how to cope from you. Limit your family's exposure to news coverage of the event, including social media. Children may misinterpret what they hear and can be frightened about something they do not understand. Try to keep with your regular routines as much as possible. With schools closed, create a schedule for learning activities and relaxing or fun activities. Be a role model. Take breaks. Get plenty of sleep, exercise, and eat well. Connect with your friends and family members via social media and telephone.
Many of us are assisting in the recovery efforts. Many first responders and essential personnel such as healthcare providers, grocery workers, and our own social service staffs and others with direct contact with the public can be especially impacted. What stress management advice do you have for our first responders?
Responding to COVID-19 can take an emotional toll on you. There are things you can do to reduce secondary traumatic stress reactions. First, we need to acknowledge that secondary stress can impact anyone helping families after a traumatic event. Learn the symptoms, including physical symptoms such as fatigue and illness, or mental symptoms such as fear, withdrawal, and guilt. Allow time for you and your family to recover from responding to the pandemic. Create a menu of personal self-care activities that you enjoy, such as exercising or reading a book. Take a break from the media coverage about COVID-19. Ask for help if you're overwhelmed or concerned that COVID-19 is affecting your ability to care for your family and yourself.
Finally, we are all stuck in our homes. What are ways to utilize time sheltering in place more effectively?
Declutter your house. It will feel so good. It's you taking control in an uncontrollable situation. Write. Writing, no matter what kind you do, taps into an expressive, thoughtful part of your inner self. Improve your relationship with someone who's very important to you. This might be anyone you've always wanted to have a better relationship with. Become more familiar with your emotions. Journal. Your feelings are amazing tools that you could harness to assist you in self-knowledge, self-expression, and decision-making. Make a list of the strengths that got you through previous life setbacks. Be grateful every morning when you wake up healthy and alive. Gratitude has been found to be a major contributor to life happiness. Think of a goal that's achievable now that could not have occurred to you in the pre-COVID world. This might be anything positive and healthy. Reach out to someone you care about but have lost track of due to our hectic life. Practice or learn a new skill. Take an online course or read a book. Give. Find a way to help a person online or to offer help to them. Take steps to deepen your spiritual life.
So, Mary Beth, in summary, you really are suggesting talk candidly to your children, take breaks from the news, as a first responder, acknowledge the stress and talk to trusted others, and make a plan to use your time at home effectively. Thank you for these valuable tips, and let's always remember that Christ cares for us and that we can, through prayer and meditation, feel comfort.